everyone, my name is Ethel Jean from BSN2A. In today's video, I'm going to discuss one of the core pillars of medical ethics, the autonomy, the patient's right to self-determination. If you're not familiar with autonomy, then you will be after this video. So autonomy, it is the individual's right to accept or refuse to any given treatment. The treating physician is required to inform the patient of the details of the treatment provided, the risks and benefits of the treatment provided, and the alternative treatments. So in medical ethics, a patient has the ultimate decision-making responsibility for their own treatment. So why is autonomy important? Autonomy is important because we need to make sure that the patient is actively involved in their diagnosis and treatment, and not just referring to their doctor. So one of the great examples of autonomy is that when a patient refuses for certain treatment because of his strong religious beliefs. So here is the sample case wherein a Jehovah's Witness patient come visited to the clinic complaining some symptoms such as persistent fatigue, fever, recurrent nose bleeding, feeling dizzy or lightheaded, and shortness of breath. The doctor suspected it as a sign of having a leukemia. To make sure, the doctor took a blood sample, and when the blood test results came out, it shows that the patients have a very low platelets and abnormal red and white blood cells count. This is highly suspicious to leukemia. So the physician goes back to the patient and explains the findings and recommends to do a bone marrow biopsy to confirm the diagnosis. The patient agrees to the doctor. When the test results came out, it was positive, and according to the findings, the patient has an acute promyelocytic leukemia or APL, wherein her cells in the bone marrow that produces blood cells, such as red cells, white cells, and platelets, do not develop and function normally. The doctor discussed the results with the patients and explained that in order to treat this kind of disease, she needs to undergo chemo or chemotherapy and transfusions of platelets or other blood products. Now, autonomy gives the patients the full right to accept or refuse the treatment. In this case, the patient refuses the treatment because it contradicts their religion and their beliefs that blood transfusion is forbidden by biblical commands. Now, the physician has a prima facie duty to respect autonomous choice of the patients and give greater priority to the respect for patient's autonomy than to other duties. However, some ethicists claim that in respecting the patient's choice not to receive blood, the principle of non-maleficence, which is to avoid harming people, and the principle of beneficence, which is to do good, also applies and must be interpreted. Since the respect to autonomy always in greater priority, the consequences of refusing a blood transfusion must be made clear to the patients that this might cause complications and risk of dying from blood loss. The physician's duty is to properly and compassionately inform the patient so that the patient can choose freely with her full knowledge about her case whether to accept or refuse the treatment. Autonomy can work in both ways where that a medical practitioner cannot impose treatment on an individual for whatever reason, except for cases where an individual is deemed to be unable to make autonomous decisions. For example, if a pregnant woman is in her third trimester and she requests a cesarean section from the treating physician, but the treating doctor knows that this patient can deliver vaginally with no problems, and then there are no mechanism for cesarean section. In this case, because the treatment is unelective and optional, the physician can practice their own autonomy and refuse providing this treatment. That is all for my video, and if you have questions and comments, just let me know. But if you don't, then see you in the next one. Bye!